Hi, it's Dr. JJ, and I'm here on the set of Home and Family, and there are a few questions that we didn't get around to as far as food allergies. So I wanted to give you a little bit more information because these are really common questions that I face in the office and common concerns that are out there amongst you who might be concerned about food allergies in your children. The first thing is, if my child has an egg allergy, can my child get a flu shot? Especially this time of year when we're trying to protect everybody before the big season hits. The answer to this is yes, under most circumstances. If your child has a mild or moderate egg allergy, getting a flu shot is perfectly safe. However, if your child has had anaphylaxis from eggs, then a flu shot is not indicated. Now, if your child is older or you're an adult with an egg allergy, there's a new flu shot out called Flu Block. You can talk to your allergist about it, and this particular vaccine is not incubated in any kind of egg material and is safe for those who have had anaphylactic reactions to eggs. So ask about Flu Block. The second question is, are hives a sign of food allergy? Well, yes, they can be, but interestingly enough, especially in kids, hives can come from many things, especially viral illnesses, all year long. So if your kid has a sniffling cold or has diarrhea or has any other kind of viral syndrome, hives can be a part of that. And if you attribute the hives to a food your child just ate and that the food is actually not the culprit, then unfortunately that creates a lot of anxiety in you as a parent. It creates a storm at school if you're restricting that food, when in fact those hives had nothing to do with the food your child ate. So I think if your child gets recurrent hives or you suspect that there may be an issue with food, please see your pediatrician or a pediatric allergist and sort it out, because a life without certain foods may not be a fun life, and if you don't have to walk around anxious thinking you're sitting on a powder keg, that's a good thing. So that's question number 2. And question number 3 is about peanut butter, because peanut butter is the lifeblood of most of Americans right now. And so many parents are afraid that their child who is peanut allergic may die or have an anaphylactic reaction by even just touching peanut butter or smelling peanut butter. So here's the skinny on that. There actually has been a very, very well done controlled study looking at children who have peanut allergies. Peanut butter was applied to their backs along with a placebo nut butter. And the children were asked, without being able to see what was going on their backs, did they feel anything? And only on rare instances did they get a sense of local itch or redness. So the application of peanut butter to the skin or touching the peanut butter would not cause an allergic reaction. Now, if you put that peanut butter in your mouth and you're peanut allergic, yes it would, but just the application of it onto skin is not a dangerous thing. The second thing that's so important to know is that just smelling peanut butter or smelling peanuts is not going to rely on or cause anaphylaxis either. The reason being is that the smell that makes peanut butter so distinctive doesn't have any protein in it. The chemical that comes off of peanuts or peanut butter has no protein. So if you are smelling peanut butter, that's not going to cause a reaction. Now, if someone was grinding up peanuts in front of you and you had airborne protein that you deeply inhaled, that in fact might have the potential to cause a severe allergic reaction if you have that history. So smelling peanut butter or having it touch your skin, not an issue. So let me talk about a third thing, and that is traveling during the holidays and worrying about peanuts on the plane. Here's the skinny on that. Dr. Matt Greenhot at the University of Michigan is a well-known pediatric allergist and immunologist, and he actually looked at the best ways to travel with kids or adults who have peanut allergies. And here's the advice that he gives. Because it's impossible to wipe out all peanut protein from the carpeting, from the airline seats, from the handrests, or even from the tray tables. Just simply banning peanuts on a flight isn't the answer. The answer is talk with the airline beforehand and arrange for pre-boarding. That'll give you a few minutes to go to your seats, take some Clorox wipes or some other cleansing wipes and wipe down the tray tables, your hand rests, and bring a cover for the seat on the plane if you're really concerned about airborne peanut protein being in your environment. So that could be something as simple as a sweater, a sheet, just something discreet, but something that covers the seat, clean the surfaces, and have a great flight. So hopefully that will give you more information about allergies, especially when it comes to holidays. And be mindful too that when a child or an adult says they truly have food allergies, respect that and don't assume that just putting a little sprinkle of their allergen on something wouldn't hurt them, because for some kids and for some adults that could be a life-threatening reaction. So when in doubt, don't include those allergens in your holiday cooking. Respect the folks who come to your house, hoping that you will respect their health and their health needs, and have happy and safe holidays.